My name is Ashley, and this is the physical exam portion of the class. This is my lovely assistant, and she has agreed to let me do her physical examination today. And so she came in and she shook my hand. She speaks fluent English. There was no deviation to her gait. She appears very well groomed, well kept, and appears to be in very good health overall. So normally in our clinical setting, I would have her change into a gown, but we're not going to do that for this portion of the exam. And then I would have taken her vitals, and she is 5'5", 119 pounds. Blood pressure was 122/78. Resting heart rate was 54 beats a minute. Temperature was 98.6 orally, and her respirations were 18. We are going to, I did have her void her bladder, and her vision was tested with the Snelling eye chart, and she was found to have 20/20 vision. I'm going to start with the inspection of the head and neck. First I would look at her scalp, make sure there's no lesions, no cranial malformations or anything like that. Her head feels nice and smooth. I don't see any lesions or scarring on her skin. I'll look behind her ears. It's a good place for skin cancer. Look at her neck. Look at her eyes. Look at her eyebrows. Okay, and everything looks pretty good. Okay. And then I'm going to test some cranial nerves. Cranial nerve 1 and cranial nerve 9 will be referred for this particular portion. Cranial nerve 1 is the olfactory, and then cranial nerve 9 is the sense of taste, and we are just doing that for lack of props. Cranial nerve 1 will be tested with different oils. She could occlude one nostril and smell and tell me what she is smelling, and then with the other cranial nerve that we are not testing, she would taste something salty, sweet, bitter, tell me what she is testing. So we'll start with cranial nerve 5, and what I'm going to have her do is, this is a light differentiation between sharpness and soft touch. So I'm going to touch you with either the cotton swab or the paper clip, and you tell me if it is sharp or soft. Okay.
Okay.
So I'll have
soft, sharp, soft, sharp.
Very good. Okay, and then for the cranial nerve 7, I will have you clench your teeth and smile real big, and raise your eyebrows, wrinkle your forehead, puff out your cheeks, and make a grimace face. Okay, very good. And then I'm going to inspect your jaw. I'm going to have you clench your teeth and open your mouth. Okay, very good. Okay. I'm going to inspect your facial bones. I'm going to palpate your sinuses. Do you have any sinus pain or pressure?
No.
Okay. So after that, I'm going to inspect her eyes, and this I'm going to look we did the Snellen eye chart. We would also do the nearsighted vision test with the Rosenbaum card, and really what that is you hold a newsprint would also work. You can hold it about 14 inches away from you, and you read the smallest line possible, and that tests your near vision. So I will look in your eyes. Once again, look at your eyebrows, look at your eyelashes, make sure there's no droopiness of the eyelids or anything like that. Palpate black hole. Look at your sclera and your conjunctiva, make sure it's not red or bleeding or you have any eye discharge. I'm going to test pupillary response to light. Okay, very good. Then I will check your function of the eyes. I'm going to use the 6 cardinal fields of vision, and you just follow the light with your eyes and try not to move your head. Okay, very good. So after the eyes, the extraocular eye movement also tests cranial nerves 3, 4, and 6. So after, I'm going to test her hearing and look in her ears, and I'm going to use my prop otoscope. So I'm going to hold the pinna up and back, and I would place the cone in her ear and use the biggest cone that can fit comfortably, and I would look in and make sure there's no waxy buildup, there's no inflammation, and make sure that the eardrum has a light pearly gray sheen to it, and that there's no fluid behind it. And Rhine test, the Rhine test measures between bone conduction and air conduction. What I would do is say this is a tuning fork, and I would smack the tuning fork and hold it on the Badwey process, and you would tell me when you can't hear the conduction anymore, and then I would move it to your ear, and you would tell me when you cannot hear it anymore. I would time both of them, and bone conduction should be longer than air conduction. For the Weber test, again, I would smack the tuning fork, place it on top of your head, and you'd be able to tell me if you can hear it from one ear, or both ears, or one ear or the other. Normally you hear it from both ears. If you can't hear it out of one ear, that may indicate that there is a problem. Let's see. Then I would move on to the nose. I would check the septum, make sure it's straight, make sure there's no foreign bodies. In the nose, I would use a nasal speculum and look, make sure there's no deviations to the septum, there's no ulcers inside the nose, no nodules or anything like that. Then I would inspect the mouth. I would inspect the mouth closed first, make sure there's no fissures, make sure the lips are not dry or cracked. I have you open your mouth, and I would inspect teeth. I would check gag reflex, and have you say ah, ah, and I would check for the uvula, make sure there's movement, and check for tonsils. In this case, she does not have any tonsils, but if she did, I would make sure that they are not swollen, there's no beefy redness. To assess her cranial nerve 12, so I'm going to have to stick your tongue out, to the left, to the right, try to touch your nose, and try to touch your chin. Okay, very good. Assess her neck. I'm going to check carotid pulses, one side separately. Going to assess her trachea, make sure it's in line, and then her thyroid. Can you swallow for me? Very, very good. And I'm going to have her lean back. And I would use a pillow to prop her up, but I would 45-degree angle, make sure there's no jugular venous distension, and she looks good. Then I would assess or auscultate her carotid arteries, each side separately. Make sure there's no bruit. Okay, very good. And then I would palpate her lymph nodes. I would inspect for smoothness of the neck, and everything looks good. active range of motion, I'm going to go against your head. Can you go try to turn your head to the, or move to the left and to the right and try to go back and forward? Very good. Now I will do the lymph nodes. I would begin with the pre and post auricular behind the ears. Pre and post auricular behind the ears, back to the occipital, down the tonsillar, the submandibular, the submental, down the cervical chain, into the superior and inferior cervical chains, and then this supraclavicular. Can you put your head down a little bit, please? Normally you can't feel any lymph nodes, and then the deep cervical chain you can't feel, usually is normal. If you can, if you push down to try and feel the lymph nodes, you will probably displace them, and you wouldn't be. For neck, I'm going to check carotid pulses, one side separately. Going to assess her trachea, make sure it's in line, and then her thyroid. Can you swallow for me? Very, very good. And I'm going to have her lean back. And I would use a pillow to prop her up, but I would 45-degree angle, make sure there's no jugular venous distension, and she looks good. Then I would assess or auscultate her carotid arteries, each side separately. Make sure there's no bruit. Okay, very good. And then I would palpate her lymph nodes. I would inspect for smoothness of the neck, and everything looks good. Active range of motion, I'm going to go against your head. Can you go try to turn your head to the, or move to the left and to the right and try to go back and forward? Very good. Now I will do the lymph nodes. I would begin with the pre and post auricular behind the ears. Pre and post auricular behind the ears, back to the occipital, down the tonsillar, the submandibular, the submental, down the cervical chain, into the superior and inferior cervical chains, and then this supraclavicular. Can you put your head down a little bit, please? Normally you can't feel any lymph nodes, and then the deep cervical chain you can't feel, usually is normal. If you can, if you push down to try and feel the lymph nodes, you will probably displace them, and you wouldn't be. After I would assess her lymph nodes, I would go further down her arms and palpate. I would palpate brachial pulses, radial pulses, check for skin turgor. It's nice and springy, so no signs of dehydration. I would assess her hands. I would assess her nail beds. She has a very nice manicure, but if her nail beds weren't painted, then I would blanch her nail and assess for capillary refill. Less than 3 seconds is normal. Check color, check temperature, check hair distribution, and everything looks nice. So I'm going to stand behind you and whisper something, and you'll hold one ear. I'll whisper something, you repeat what I said, and then we'll do the other one. Okay.
8B4.
Okay.
4T2.
Perfect. Okay. So I'm going to, after I would palpate your lymph nodes, I'd go ahead and do your cranial nerve 11, and I'm going to have you move your head against my hand for resistance. Go, and you can turn your head, and turn your head this way, and then tilt your head back, and tilt your head forward, and then lift your shoulders against resistance. Okay, very good. And then that is cranial nerve 11. And then I will also check, I would have you come back at about a 45-degree angle, and I would check your neck for any jugular venous distension, and that would be indication of some hypertension, and you're fine. So, moving on, I would move down your arms. Feel any can't really feel any lymph nodes, but I can feel for brachial pulses. I can feel for radial pulses. Make sure chest for temperature, hair distribution. I would check your fingernails, and she has a beautiful manicure, but I would press down on a finger to check capillary refill, and it should be less than 3 seconds, and then the skin and all those characteristics look really good. So I'm going to have you stand up now. I'm going to have you face me, and actually I'm going to have you turn away from me, and I'm going to assess the back and posterior chest. First, I'm going to have you take a couple deep breaths. I'm going to assess your breathing, your rate, and your rhythm. Make sure there's no heaves or anything like that. So I'm going to your breathing and your respiratory efforts look fine. So I'm going to lift your shirt up a little bit. On the 10th intercostal space, I'm going to have you take a deep breath. Diaphragmatic excursion. I'm going to palpate for expansion while you're breathing. And then tactile phrenitis, I will have you repeat 99.
99.
And Mickey Mouse.
Mickey Mouse.
And then I'm going to percuss your posterior chest. I'm going to go kind of in a zigzag pattern down your back, along the sides, and then down your costovertebral angles to assess for any kidney tenderness. And I'm looking for any dullness. It might indicate fluid or kidney tenderness. I'm going to have you stick your arms out like so. And that all sounds fine. And then you can put your arms down, and I'm going to auscultate, going left to right, comparing side to side. So I'm going to have you take a couple deep breaths. Okay. Okay, can you put your arms out again for me and take a deep breath? Okay. And I'm going from side to side to compare, make sure both sides are clear. And last time. Okay, I'll have you put your arms down, and if you could turn around and face me. And I'm going to be doing the same thing. I am looking, inspecting the chest, making sure there's no obvious like heaves or problems breathing. I'm going to assess tactile phrenitis, if you would say 99.
99.
Okay, and then I'm going to listen again. Deep breath. Okay. Very good. And then I'm going to have you stick your arms out, and I'm going to assess axillated lymph nodes. And that tickles, and I'm sorry. Okay. So then I will auscultate your heart, and I would listen for breath sounds, make sure there's no friction rub or pleurisy or anything that would inhibit my hearing of the heart sound. So I'm going to start on the right side, second intercostal space, and that is the aortic area. And you can breathe normally. And then the pulmonic area is the second intercostal space on the left side. Erb's point is about the third intercostal space. Tricuspid area is fourth intercostal space. And then mitral area is fifth intercostal space. And that's also the apex of the heart, so I'm going to have you hold your breath for just a couple seconds. Okay, very good. Okay. And I did measure you for JVD, and that was fine. So for assess her abdomen area, I'm going to have her lay down. Okay, and then I would inspect the abdomen and inspect its characteristics, its contour, and I would auscultate all four bowel sounds, all four quadrants for bowel sounds. So she is nice and rumbly, and then I would auscultate the arteries, the aorta, the renal arteries, the iliac arteries, and the femoral arteries. I will percuss her abdomen for tone, and usually it's a high-pitched tympanic sound. I would percuss the liver borders. I would start from the side and work my way up till I go from tympanic to dullness. And then I would go work on the other side up for the spleen. And I would start over to the side in the tympanic area, and I'd go up on the right side and percuss until I hear dullness. Then I would do light palpation, which I would only go about 1 centimeter deep for obvious masses. And then I would go into more deeper palpation, which is greater than 1 centimeter deep. And I would palpate on the sides. I would also assess the midline for any abdominal aortic pulsations, and I would assess the contour of the abdominal muscles and make sure everything is nice and even, and she looks great. So I'm going to have her sit up. I'm going to go ahead and assess her legs. I would check for hair distribution, for circulation, and I would go ahead and palpate pulses, the dorsalis pedis, the post-tibialis, and the popliteal. And you can also check for cap refill circulation in the toenail beds, and then see if there's any lesions on the skin, and everything looks really good. Also assess the midline for any abdominal aortic pulsations, and I would assess the contour of the abdominal muscles and make sure everything is nice and even, and she looks great. So I'm going to have her sit up. I'm going to go ahead and assess her legs. I would check for hair distribution, for circulation, and I would go ahead and palpate pulses, the dorsalis pedis, the post-tibialis, and the popliteal. And you can also check for cap refill circulation in the toenail beds, and then see if there's any lesions on the skin, and everything looks really good. I'm going to have her turn and away from me and bend down. I'm going to check her spine. I did check her cervical spine when I did her neck examination, so I'm going to check her lumbar spine and make sure there's no curvature or deformities of the spine, and she looks nice and straight. I'm going to have her stand up. I'm going to assess her shoulders, make sure that they're nice and even with each other, make sure that there's not one hip higher than the other. I'm going to have her turn and put your hands on your hips, and can you go left and then right, and then kind of twist side to side from your trunk, and then take your arm and you go up, down across your body, back behind your head, and then over to the small of your back, and then to the other side, and across your body, above your head, and down to your back. And then I'm going to have you sit on the bed and I'm going to test your reflexes. And I don't have a reflex hammer, so I'm just going to pretend, but I'll start with your brachial reflexes. And I would use the hammer and I would tap in the spot, and her reflexes would go. I would use her, test her knee reflexes and her Achilles tendon down behind her ankle. And then I would test the strength in her shoulders and have you try to push up against there. Very good. And then same with your, try to push, and then your feet, can you push out? Don't let me push them down, and then don't let me pull you away. Okay, so this concludes the exam, and I would thank my assistant for being very, very helpful, and see if she needed to follow up with anything, then we would recommend that. But she's pretty healthy, and I will bid her good day. So thank you very much.